So today we have Clara Russell with us. Clara is a well-experienced GP who did her training in Newcastle and then went on to develop her career in what we would probably call non-traditional ways. Clara is very keen on looking at the aspects of the NHS that deal with mental brain health, lifestyle medicine and functional medicine. So Clara's going to just share something of your journey as we go along. Clara, welcome.
Thank you. Thanks very much for having me.
Clara, can we start by just run me through your, what brought you into medicine in the first place?
I think patients brought me into medicine, and the idea of being with patients and hearing their stories and trying to do something to help. My brother has severe epilepsy and learning difficulties, so I was sort of around a patient all throughout my life without even really realizing that was a thing. That's just how he was. So I think that that was there from the beginning. And then I think some of the usual things came in: an interest in science, definitely an interest in people and helping people, and a very close family friend who was a GP who just struck me as somebody who was just brilliant and amazing, that he could help people and look after families. So those sort of things kind of set the foundations for a career in medicine.
And you went to Newcastle. Why
I did. There was two different answers for that. One is it's an hour and a half on the train from Edinburgh, so it felt at that time that it was far enough away, but still easy to get home. So that was that. But in terms of medicine as a place to study, at that time they were really sort of pioneering being introduced to patients from the very first year of university, and very sort of hands-on clinical teaching. Whereas at that time, so it was 1997, so at that time a lot of the universities were still doing sort of preclinical for the first 2 years and then clinical, and I really wanted to be in amongst the patients from as early as possible, and obviously from when it was safe to be there, and Newcastle offered that, so those things really combined to set that as the place that I really wanted to go. And it's a great city, Northern England, really lovely people. I had extended family there, and it's got a lot going for it. And that just ticked all the boxes for me as a place to go.
Yeah, I remember going to Newcastle, and the wind was what I remember. Especially at this time of year in November, December, and I used to have friends in Gateshead.
Right. Okay.
You're either blown up the hill or blown down the hill.
Yes, yeah, that's definitely true. And of course, there's always the fact that no one likes to wear a coat either. So there was still that. That's something I did learn from my time there, having grown up in Edinburgh, where we're all coats and hats and scarves. It was there was lots of differences in Newcastle, but yeah, it's a really great place, and I think really sort of made me, I think, as a young adult and as a junior doctor.
So did you get converted to the nun court?
Towards the end, there were moments. Yeah, there were definitely, I won't lie, there were nights that I did jack the coat in, but most of the time I would say I stuck true to my roots and kept on to it, paid the pound to put it in the cloakroom, or carried it with me, but occasionally.
And where did you move from in terms of your career after medical school in Clara?
So I completed medical school in Newcastle and then stayed around the northeast for my sort of junior doctor sort of training. What happened next, and as I decided to go into general practice, I stayed local really. I sort of took the option to create my own GP training, which was lots of people had done, but at that stage again they were sort of moving to more formulaic training programs, but I was still at the stage I could kind of choose my own. So that was that worked for me, and I was able to select some specialties that I was really interested in, including psychiatry and sort of neurorehabilitation medicine, which was linked in with neurology at the time, which wouldn't probably be in a traditional kind of GP training place to work, but that was something that appealed. So I chose those things, as well as sort of A&E, and I did some locum work in the area. And that all sort of led me into being able to complete my general practice training and do my MRCGP. And I did all that in and around the Northeast.
And then you moved on to sleep, is that correct?
Yeah, sleep actually came later on. So at that stage, I moved back to Edinburgh to continue with general practice. And at that stage, I was still looking for a sort of fairly traditional GP job, partnership or salaried position. And I came back to Edinburgh with that in mind. And then it was really sort of later on when I picked up some interest in more lifestyle medicine and sort of different type, lifestyle aspects, that sleep came into my sort of view. And there was a course within the University of Edinburgh that I studied, and that was really interesting.
Are there any highlights you could share with us in terms of what you gained?
I think it was just, that sleep was a specialty first and foremost. So I mean, again, so maybe without meaning to sound in any way glib, obviously I had patients they had referred to sleep clinics for specific sleep issues, but sort of when I did this course, I realized kind of what goes on in a sleep clinic, and also just the different, I mean, I was one of the only GPs there, but the other sort of specialties that were on the course were respiratory doctors, respiratory nurses, psychiatrists. There was just there was lots of different specialties that were involved. So it was interesting from that point of view. And I think just really the science of sleep. I mean, I probably learned, even just in the sort of the first lecture, I felt like very much I was back at the very beginning of medical school, because it was just felt like it was completely brand new and just really fascinating. Although also extremely complicated, because we also had sort of went back through sort of physiology aspects of different things, which felt quite difficult at the time. So I think the depth of it, and the importance of a sleep medicine facility and a sleep medicine clinic, having access to that. Also, probably that a lot of people I think it's possibly not used enough. I think there's probably we under refer as GPs, possibly because you just take a lot of sleep disturbance and problems linked to sleep as being just par for the course, or because of other things that are going on. But I did learn that in the same way that you wouldn't kind of just keep an eye on a cough for months and months and months at a time without doing anything, when people are presenting with particularly difficult sleep issues, there's specialist help available and they can benefit from specialist input. Obviously the challenge is, waiting times and what's actually available. But in principle, I think it's underused, and we just don't think enough about how important sleep is and how people need help with it.
Yeah. So I'm a little bit older than you are, so I can come back to the days when people would quote Margaret Thatcher saying, "Oh yes, well you only need 4 hours." And I think that became part of the culture of saying, yes, disturbed night sleep, incomplete nights, short night sleeps are just par for the course. Just get on with it.
Absolutely. And again, there's times in life where you will have poorer sleep. Obviously, if you've ever done work in night shifts as we have, and as many professions and jobs do, then you just accept that your sleep routine is back to front and upside down, and that you probably don't get a sufficient number of hours. But well, it is what it is. And then obviously when people become parents and they go through challenges with children's sleep and their own sleep, again, it's almost a badge of honor, I think, sometimes that, I've only slept 2 hours, or I've been up 10 times or whatever. And we talk about it, but actually yes, it's part of the children growing, and that's how it is. But finding ways to adapt with that and trying to look after yourself at the same time is incredibly important.
Yeah, yeah. So what drew you to the idea of lifestyle medicine?
I think a few different things. As I say, obviously growing up with my brother, he has quite a complex epilepsy whereby the medications that he's been prescribed for his seizure control have had sort of very sort of limited benefits for him. So kind of I'd always heard talk of things like the ketogenic diet, or just those kind of things had been mentioned at different times, so I was aware of that. I think really within my patient group as well, I kind of got to a point where I was really just feeling a bit frustrated with what I could offer and how I could help, because I was finding I had quite a lot of patients who they had fairly maybe non-specific symptoms. You went through a series of tests, maybe some referrals, and thankfully nothing serious came from it, or there was no firm diagnosis. But that didn't always really help how they felt at the end of the day. And once I got to that point where we'd done all I could, we'd done all that I thought we could do, and I didn't really have anything else to offer, I just felt sort of increasingly kind of a bit frustrated at myself, really, that there wasn't that much else that I could come up with. So I think those sort of things were there. And I think then when I became a mother, when I had my son, I think suddenly you're just, the way you see the world changes again. And, particularly around sleep, I guess I was really sort of focused on that and learning about that for him and ourselves, obviously. And then I began to experience some of my own health issues as well in the sort of while he was a baby, which led me to looking into things in a bit more detail, really.
Yeah, certainly I know that to be true when I was doing my medical training. The word nutrition was I was going to say it's like Greek, but I heard more Greek than I heard nutrition.
Yeah, absolutely. I had one when I was doing psychiatry, actually, in my GP training, my consultant supervisor did say something which has one of those sort of medical pearls that stick with you, which was it's very difficult to have good mental health when you have poor sleep. And in the context of that, I was sitting in an outpatient clinics with people with severe conditions, and he would always ask them about sleep, and that was the first time I'd ever really sort of heard that. And again, even in general practice training, I wouldn't say we sort of talk that much about sleep, but that really sort of stuck with me. And again, I think when you just think about that, it's we know that's certainly the truth now. That's certainly the case. And we need to be talking about those things more.
Sure. So just run me through the concept of functional medicine, if you could, Clara, please.
Yeah, so functional medicine, again, really kind of came about because I was interested in lifestyle aspects, my own health concerns, and what, the issues that I had. I was actually diagnosed with having multiple sclerosis when my son was about to turn 1. And that was obviously a big shock, to say the least. And in those sort of early years of kind of coming to terms with him with that, and then with him just being so little, I was really looking for things for myself to try and help with, ways I could look after myself and ways that I could improve my chances of my condition, as well as things that might also help patients. And nutrition came up regularly in my online researching, as did exercise. And again, at that stage, I was kind of unsure really what to do with that. I knew those things were important, but I wasn't really sure how I wanted to sort of learn more about it. I couldn't really see myself going on to do nutrition qualifications per se. I didn't have the sort of space in my life for that. And then I sort of came across functional medicine, which encompassed sleep, exercise, nutrition, and how that sort of plays into lifestyle. So that really, again, felt it felt like a great fit to be a sort of learning platform to understand more about those things, both for myself, but also as a health professional, and how it could help people.
And are you able to share some detail of what you discovered that helped your personal life?
Yeah, I mean, I think the first thing, the course that I did was, I think, again, people talk about having done functional medicine. I think most people do this sort of 5-day course which they call the AFMCP, which is kind of their introductory course that looks at all the different areas of functional medicine. And really, when they're talking about functional medicine, they're talking about looking at medicine in a different way and really looking to find the root cause of different conditions. Certainly, a lot of it sounded quite woo-woo to me at the time, and I was skeptical. But again, I think being a patient as well as a doctor, I was definitely a lot more open-minded than I might have been a few years before. So when I went on the course, I met there was a lot of nutritionists on the course, and there was also some GPs that I sort of linked in with. And I think we all had similar sort of experiences with patients and wanting to be able to offer more and learn more really ourselves. So that was really helpful. And I think the course basically just presented the research around lots of different aspects of exercise, sleep, and really a lot more a holistic view of healthcare. I guess that's probably very overgeneralizing, but it was a very sort of deep dive, I guess, into some of these subjects with the research sort of to back it up. So that kind of felt really sort of validated it in my mind as definitely having something that I really wanted to look into more.
Yeah. I guess, sorry, do carry on.
Yeah, I was going to say the topics, again, it's hard to sort of think a bit about it now, because some of the things they talked about then are quite commonly talked about now, sort of the concept of gut health. And I can absolutely hand on heart say that was, I did the course in 2017, and when they stood up and talked about gut health and the microbiome and even what that was and why that was important, I mean, I was just like, I have no idea what this is. I've never heard of this. And I don't know, I think it sounds quite important. And oh gosh, really, it was just fascinating. And again, I think that was also really good because you were learning something new, which I don't know, I probably wouldn't have learned in just sort of usual sort of GP general practice updates and things. So again, it was, we got there was a lot from it.
I think my understanding of the NHS and the way it is fairly segmented and bunkered and siloed in knowledge. So to have a broader picture, and I mean, I look at GPs and think, you guys know everything, because when I did anesthetics, all I knew is how to put you to sleep.
Yeah, yes, yeah.
So GPs were like the jack of all trades who obviously knew everything. And so it's quite a surprise to realize that the huge gaps that we as a medical profession have that are sort of either not acknowledged, or if you acknowledge it, you think, well, it's not really that important because we have a set way of doing things. You follow this procedure and you should come to an answer. And if you don't come to an answer.
Yeah, absolutely. And it feels very protocol driven. And we know the reasons why that is, and that is essential for, clinics to, for people to be able to move through clinics, and for, GPs to be able to get through the day, because, you're so busy, and you have to have a series of checklists, both mentally in your own mind, but also in tangible terms that you're working through. And again, a lot of the time that is enough, and that's what people need. But obviously there are times when that you just kind of run aground with that, and that was certainly the sort of the frustration I'd experienced with some of the patients. And again, at that time, I was beginning to see some of that in myself and in my own health, that I knew that I was doing all the right things technically, but there were still sort of symptoms I was experiencing and ways I was feeling that I wanted to see if I could sort of address in a different way. And from sort of reading around functional medicine and from what some of the things they taught us on the course, kind of understanding why taking a mindful approach and meditation, even sort of looking at ways to reduce your stress, how important all that is, was really sort of life-changing for me, I'd say.
So would you think that sort of approach had a benefit for you personally in terms of mindfulness or stress reduction?
Absolutely, yes. I think just being aware that it's an important thing to do, I think, for a start, or to even address your stress. I think going back to like what we said about sleep, people accept that they don't sleep well. How many times do you hear someone say, "Oh, I just don't sleep well, like I never have," and that's it. And again, I think with stress is another thing. We people talk, everyone talks about being stressed, and it's just part of the lexicon. And I think in some ways that's great that we're all talking about it and we feel a lot more open, but similarly we kind of pass it off as just being normal, and actually it isn't really always normal. Yes, an element of stress is important, but the distress that comes from too much stress isn't normal, and recognizing that in yourself and having ways to try and deal with it is essential. And again, I think I'm just not sure I'd really thought about it in that way before, until I kind of had that kind of learning myself.
Yeah, and I think that's true in that it's almost, for me, it's like theoretical. So it's, yes, we all talk about stress, but it's something that's either you can't affect, so there's no agency in it, or it's something that's out there that we'll deal with at some particular point in time. But in the meantime, I guess, certainly for GPs, you're limited in just time with patients to talk about these things and to deal with these things.
Yes, absolutely. It's just impossible, 10 minutes, 15 minutes, it's just not long enough to talk about, these kind of areas. And, something like stress is, or, some of the symptoms that arise from being stressed, often people wouldn't even recognize that they're stressed in the first instance. It's other things that they present with, and that's what they want to talk about. So to even begin to open the conversation around, well, are you experiencing any times of stress at the moment? Like that's a whole other area that unless they bring that to you, you're that takes a lot of time to kind of get to that point to have that sort of conversation.
Yeah. Just to segue the conversation a bit in a slightly different way, can you tell me what sort of, do you have an exercise routine, pattern, things that you do that are beneficial for you personally?
Well, that's a really interesting question, because I can, again, hand on heart, say that I have been an exercise avoider my whole life. So again, another one of these things that I know the benefits of it. I would tell anyone else the benefits of it. When I studied functional medicine and lifestyle medicine, I really learned the benefits of it, but that didn't really mean I was still doing it myself, because naturally I just wasn't drawn to exercise. So I've worked quite hard to try and find something or some ways to be active and to have a routine. And I think even just sort of having the time at home during the pandemic, and even sort of into this year, I really kind of, that was my moment of thinking I've really got to get on top of this. So I can say, yes, I do have an exercise routine now. I would not have had that if you'd asked me probably even a year ago, or 2 years ago, but I do now. And that's something I'm quite proud of myself that I've managed to pull something like that together, because having, as I said, spent all these years avoiding it, to have things that I actually am happy to do is progress.
Well, I can hand on my heart tell you that because I'm a little bit older than you, I have had longer experience of exercise avoidance than you have.
Oh, it's not just me then, thank goodness.
No, it's not just you. But I think it reflects a lot of people's perception of exercise, or what it means. And the word exercise shows up all sorts of, well, maybe either pink leotards, muscly guys in front of a mirror in a gym, or and certainly for me, I don't think of myself in any of those situations. Though I have over the last couple of years, before the COVID situation, been to gyms, and it's been great.
Good. Yeah.
I keep away from the mirrors, but I'm happy watching the I don't know what programs they have with this music on. Not
Right.
that I fancy that either, but it's a better choice than the mirrors.
Yes. No, I don't know who even had the idea of putting mirrors in a gym. I mean, I think it's just ridiculous. But no, well, that's good that once you find something or a way that you enjoy it, or at least can just do it, even if you still don't enjoy it that much, that's got to be a good thing. Yeah.
Well, my wife says to me, you have so many YouTube friends nowadays. I don't see you because.
Oh, really?
Yeah, I believe in the movement bit rather than the exercise bit.
Okay. Yeah.
Movement. If you can micro move, it's far more beneficial than sitting all day wishing I could go to the gym. Or it's
Absolutely.
difficult to get out, whatever it is.
Yeah, and I think that's something I've really, and again, probably the daily walk, excuse me, the daily walk in the lockdown one, whatever, as long ago as that was, I think that actually really brought that sort of home to me as well, that just doing something, again, I knew that in my mind that doing something was better than nothing, but it was always easier just to say, well, it's not enough or whatever. But I think doing that walk every day, and we just literally, we went the same route, my husband and my son and I, and it was boring, but it was the highlight of the day still back then. And I actually, again, we know about habits, don't we, and how difficult it is to create a habit. But I think doing that was the start really of me kind of just getting the foundations in of trying to bring movement in and being active and having my own routine.
Yeah. And so now you have founded a company called Noggins.
Yes.
What's that about, Clara?
So Noggin is really around obviously brain health and brains, and with a mission to try and improve the cognitive health of the nation.
Yeah.
Brains and brain health have been as part of me in my life for as long as I can remember, even if I didn't really realize it. And as I said, the events of the last few years, combined with my own learning, have really made me realize how important brain health is. The research is there, where dementia is the biggest killer of women in the UK and second biggest killer for men, and we're up against it basically. And we know that some of these lifestyle factors are incredibly important, both in disease reduction for something like dementia and mental health conditions, but these lifestyle things also make a difference in how we feel every day. So kind of taking all those things together, I really wanted to create something and that was going to help people understand what we can do to look after our brains. And Noggin is it. That's what we've done, and that's what we're looking to really just help get the message out around what we can do to look after our brain health.
So Noggin is educational as well as product.
Yes, yeah. So we have we have nutritional supplements. Basically, when I was looking at the things that are important for brain health, which are also most of the things that are important for lifestyle health, we came across all the evidence and basically formulated the sort of building blocks of better brain health, which includes gut health, movement, rest, sleep, purpose, connections, and nutrition. Nutrition is incredibly important for how we feel and our brains, and as part of that, we have formulated some nutritional supplements to support some of the needs that we all experience when our brains are not at their best. And and we've got the products that we're developing with more to come to try and help with some of those needs.
And from what I've seen, you've divided it into, well, Johnson, you need to calm down, or Johnson, you need to get more excited or excitable.
Yes, yeah. And again, sort of the roots of it were extremely organic in terms of, you know, my own health and the experiences that we've had in our family. And it really all started from looking at nutrients that, you know, what could we be taking? What do I need to do to kind of help with this situation? And the more I read and sort of researched, so much came back to the B vitamins and the benefits of these for brain health. And again, not something I'd really been that aware of up until that point, but you know, basically, yeah, the role of vitamin B12, B9, and B6 particularly were, you know, there was evidence around from the University of Oxford then a few years ago to show that that you know, taking those vitamins helped with some mild cognitive impairment. So that was kind of the start of looking at specific nutrients. And what we've sort of gone on to do is work with a nutritionist, 20 plus years of experience, to take the things that I read about and learned about, along with her knowledge around other ingredients, to create a product to help really with energy and focus, called Oomph. And then we have another product to help with feelings of stress and to help with relaxation, which is called Pause.
Pause. I'm not going to ask you which one you think I should take, because that might get. But,
yes, both.
but make sure I take the right one at the right time.
At the right time, yes, indeed, yes, yeah. You don't want to, but they're coloured quite differently, so it is hopefully obvious which one is for which need. But yes, you want to get them at the right time. Yeah.
So, from a nutritional perspective, then, when you say that there's the B vitamins, the B12, the B6 that are important, what would you say to somebody who said, well, surely I get that in my food anyway?
Yeah, I mean, I would say probably, yeah, I used to think that too. I think it's probably the first thing I'd say. And also I'd probably say maybe you do. So I think that's where the challenge comes. I mean, I think, you know, I was taught, as I'm sure you were probably taught, that, you know, we get all the nutrients we need from our diet if you eat a healthy diet.
Yeah.
And now I'm just not really sure. I think that I think it would be great if we did, and some days we might. But if you take into account our individual variabilities, our different abilities to absorb nutrients, and also our different requirements for nutrients, as well as then the external factors around farming and the quality of the food that we're eating, I think there's so many variables, it's hard to know how nutrient rich the food that we're eating really is. Again, that doesn't mean to say that not everyone, you know, some people will be getting what they need, but I think a lot of us aren't. And I think particularly as we get older, and or if we're experiencing other health issues, if we're on medication for other things, supplementing with the appropriate nutrients can be helpful. And again, I think that's another thing I sort of learned around the sort of, you know, there's a difference between essential nutrition and optimal nutrition. And, you know, that's, again, nutritional supplements of the right type and the right quality, taken in the right way, can help with some more sort of optimal nutrition.
Certainly, I think there's a big gap, like you say, between the essential and the optimal. And the stuff that I've sort of looked at is certainly from the nutritional aspects of food. You think a carrot's a carrot, or at least I did.
Yeah.
Hold on,
Absolutely.
The nutritional value of a carrot in 1950 is not the same as the value of a carrot in 2021.
Absolutely. I know it's, and again, I don't like to think about it that way. You know, again, I like to think that it's all in there, and we're all eating the right things. And if you buy it in the shop or whatever, if you buy organic and all those things, you're getting the extra benefits. But I think the reality is we just don't know. We just don't know what's happening. And I guess just what we do know, that the nutrition, the nutrient quality of food isn't what it was. And there's lots of reasons for that yeah, I probably will never really fully understand or want to understand, but the reality is what's on your plate is different maybe to what you think.
Unless you've got your garden in the back, which
Yes.
actually is a positive way to go, and something that would help both personally as well as, you know, climate and world sort of aspects of it, that you will be better for it. And you get your exercise as you pull all those weeds up.
For sure, and you get your time in nature and your meditative time as well. So yeah, I think if you can garden, then go for it. Definitely, lots of benefits to that.
In your allotment, Clara.
Well, plant growth might be my next focus. Yeah, at the moment, not green fingered, but that might be next year's thing.
Yeah, no, it's been really good talking with you. And I look forward to seeing where Noggin goes next, and I'm sure
thank you,
it will grow in the future. And I know when we've talked before, like I said, you've had aspirations to bring in the educational side of it.
Absolutely, yes. I think even just this week, actually, I don't know if you saw, the Duchess of Cambridge was at a school down south looking at, I'm in Edinburgh, so most places are down south, but a school looking at children who are learning about brain development in babies and learning about how certain ways to talk to babies can make a difference in terms of brain connections. And again, that's something that, you know, just really rang bells with me, because I think there's so much that we can all learn about how we can look after our brains, the whole concept of neuroplasticity and the fact we can, you know, keep learning throughout life, and our brains emit, you know, change to the circumstances that we are in. It's just so fascinating and has so much potential. So to see like that getting the sort of press from the royal family, you know, championing a cause like that, I think it means, you know, in the years to come, I think all our future children will be a lot more wise about their brain health than we are. And, you know, with Noggin, that's something that's really important to us to try and help that along the way. So yes, we've got big aspirations to help people understand from all ages.
And very valuable aspirations as well.
So thank you, I hope so.
So we will see you somewhere in the physical space one day.
Yes, that would be great, yes.
And in the meantime, enjoy all that Edinburgh has to bring at this time of year.
Thank you. Yes. Well, it could be snow this weekend, I think. So yes, definitely. I'll have my coat on for that. There's no doubt about it. So
okay. Bye for now.
Thank you. Thank you for your time. Thank you. Thanks.